Well, good evening to you. Great thanks for joining us. This is Channel 1 NewsHour. Tonight, as it is right now, the ongoings in the case against about 40 suspects in the NYS theft is still ongoing at the Milimani law courts. Some of them have taken plea, others are still waiting to take plea. And it appears like the judge has decided to stretch himself as he is going to listen to all the submissions as regards the preliminary cases facing the 40.
Of course, this comes as the central bank, in collaboration with the Directorate of Criminal Investigations, are currently investigating some of the banks that are said to have been the conduits in which the money was embezzled, the NYS monies were lost. And that, of course, will be forming the basis of our interactive segment. The government now saying it will be going after the banks that were involved in the NYS scam. And we're asking you tonight on our opinion poll question, what action should be taken against banks that were used to channel stolen NYS funds? What action should be taken against banks that were used to channel stolen NYS funds? That is the question tonight. Our SMS lines, John? 22162 is our SMS line. As well as on Twitter at KBC Channel 1 at J Curia at Kato Acheng. Once again, what action should be taken against banks used to channel stolen NYS funds? Continue speaking to us. We'll sample them in the course of this bulletin as well as at the tail end of this broadcast. But of course, that appears to be what you would say a new impetus to the war against corruption. Will it result to anything? Obviously, we understand the Director of Public Prosecutions has requested for files that, as regards to the NCPB scandal as well as that of Kenya Pipeline. And maybe in the next 2 days, we expect more arrests as regards these cases of corruption. But that's not the only matter on card today, Catherine. Indeed, today is Tuesday. That means we have your health segment coming your way. And tonight we will be focusing on healthcare, affordable healthcare. Particularly, we will be focusing on cancer. Is it possible to bring the cost of cancer down? And what exactly can be done? And for that, we will be joined by Julia Oko, who is the Principal Healthcare Contracting at the National Hospital Insurance Fund, as well as Dr. Alfred Karagu, the Director for the National Cancer Institute. Of course, that is a coordinating body for all cancer control activities in Kenya. And they will be putting into perspective what is the burden of the disease and is it possible to bring the cost of treatment down. That will be our focus of discussion, so stay tuned for that on Your Health. But for now, here are the highlights. Over 20 suspects in the 9 billion shillings NYS scandal arraigned in court.
The investigations that are taking place, it is important that we give the investigators space. Let's not anticipate.
Central Bank of Kenya warns that financial entities used to siphon NYS loot to face the law. And cracking the whip. Government swims into action to eradicate counterfeits killing local industries.
A warm welcome again to this bulletin. My name is John Jacob Curia. Our sign language interpreter is Steve Dunde.
Well, my name is Catherine Achenga.
We begin tonight's coverage with news that over 20 suspects arrested in connection with the 8 billion shilling scandal at the National Youth Service are currently in court to answer to graft charges.
Now, Youth Affairs Principal Secretary Lilian Mbogwa Omolo and National Youth Service Director General Richard Dubai are among the suspects facing charges for abuse of office and conspiracy to commit economic crimes through corruption.
Ben Chumba has that report.
After spending Monday night in different police stations in Nairobi, 20 of the suspects behind the 9 billion shilling scandal at the National Youth Service were finally arraigned before the Anti-Corruption Court to answer to charges. Appearing before Chief Magistrate Douglas Ogot, Youth Affairs Principal Secretary Lilian Mbugwa Omolo was charged with 5 counts including conspiracy to commit economic crimes, abuse of office, and fraudulently making payments for goods not supplied. According to the charge sheet, Lilian Omolo, being the permanent secretary, used her office to improperly approve payment of 28 million shillings to a private company for goods that were not delivered. The offense committed between 1st January 2015 and 21st March 2017. The same charges were leveled against NYS Director General Richard Dubai, who is accused of illegally paying 28 million shillings to Ameritrade Limited for goods not supplied. At least 10 business entities alleged to have benefited from fraudulent payment of funds from NYS were also charged. These suspects denied all the charges preferred against them by the prosecution. They risk a fine of up to 58 million shillings or a 10-year jail term if convicted. The prosecution want the court to issue a warrant of arrest against NYS suspects who failed to appear in court. Ben Chumba reporting for Channel 1 NewsHour.
And like we said, that matter is still ongoing currently at the Milimani Law Courts. We're following up to see, obviously, because there's a litany of lawyers in that court and the applications are really on bond. Will the judge bat an eye and give the suspects a bond?
Imagine there are about 40 of them, so
40
that is a
of them.
case that will take a while.
And obviously that would also mean that the state slips or the judiciary slips reach if it were to give bonds.
And still focusing on a related story, the central bank, in collaboration with the Director of Criminal Investigations, is investigating banks that could have been a conduit for money embezzled from the National Youth Service.
Though he declined to mention the banks involved, CBK Governor Dr. Patrick Njoroge said the regulator is taking a two-pronged investigations approach, with the first phase aimed at recovering money that could have been lost, while phase 2 involves probing banks and other institutions that may be culpable.
Preliminary findings into the 9 billion shillings fraud claims at the National Youth Service, according to police accounts, show that some local banks were used as a conduit, raising the red flag as to whether the involved banks reported suspicious transactions to the CBK, and if so, what regulatory action was taken. CBK Governor Dr. Patrick Njoroge confirmed that indeed some banks were involved in the scam and were under investigations.
The investigations that are taking place, it is important that we give the investigators space. Let's not anticipate. Let's not anticipate. I think it would be terrible to kind of spring the suspects, right? Just like that, anticipating. If indeed you think that X is the person who is involved in this, well, let the data point to the person.
Though he refused to mention the banks involved, Dr. Njoroge said the central bank, in collaboration with the DCI, are taking a two-pronged approach, which involves probing recipients with a view to recover the resources, as well as probing banks and other entities that may have been involved.
So I can't tell you how many banks, how many people, all these things. Those are things that will be dealt with at the right time. There are two directions that we are pursuing. And you could say that the first is from the recipient's perspective, and this is the first phase. And the reason for that is, as was explained yesterday, was to recover the resources as quickly as possible. And as you know, some of those have been frozen in particular ways. And then, of course, you have the other dimension, which is banks and other entities that may have been involved in this whole case.
In what he described as an attack on the mandate of CBK, Dr. Njoroge said the Financial Markets Conduct Bill 2018, being drafted by the National Treasury, is unlikely to resolve the interest rate cap dilemma.
This bill does not deal with the interest rate caps issue, and it does not deal with the fundamental issues that led to the interest rate caps. It actually takes a step, in our view, in the wrong direction. Okay? The bill emasculates the central bank. And guess what? It also limits the power of the central bank to place banks under receivership. In our view, this really doesn't go forward. It goes backwards, substantially.
The central bank is working with 4 local banks on putting into use cryptocurrencies in Kenya. Nicholas Nduwati, Channel 1 News.
Well, of course, that story is forming the basis of our interactive segment tonight. On our opinion poll question, we are asking you, what really do you think, what action should be taken against the banks that were used to channel stolen NYS funds? What action should be taken against banks that were used to channel stolen NYS funds? The question is right there on your screen. 22162 is our SMS line. Start with your name, who you are, and where you're watching us from. Leave us a short comment. We'll sample them at the tail end of this broadcast, and of course in the course of this broadcast, but also on Twitter at KBC Channel 1, at J Curia, and at Kato Chenga. Once again, what action should be taken against banks used to channel stolen NYS funds? Continue speaking to us. But in the meantime, 2 malls under construction along Kangundo Road in Nairobi are among assets set for recovery by the government as it widens its net on beneficiaries of a National Youth Service scandal. Now, the multi-million malls are said to be a property of a senior NYS official who has since been arrested.
police are closing in on a number of buildings said to have been constructed using looted funds from the National Youth Service. Already a team is said to be profiling such buildings after tracking the money trail on the 9 billion shillings scandal. 2 malls under construction along Kangundo Road are said to be on a police radar after it emerged that they are both owned by a suspects in the scandal.
Every other scandal, the main architects always remain behind, and you find that they get a face to it. In the last one, they gave us Kabura. Now they're giving us this other innocent lady who received money.
In Kenyans, we must really be honest and agree that it takes all of us to fight corruption.
The Director of Public Prosecution is in the record, saying that the state will recover property owned by individuals widely mentioned in the scam, and their bank accounts will be frozen.
We've asked for investigations to be undertaken. There are rules. The banks are supposed to report any suspicious transactions, and they're not allowed to allow cash withdrawals of above $1 million or 999, as you know.
Among the property targeted are the suspects' houses, plots, cars, and other personal property said to have been gotten through the illicit money. Samson Kitavi, Channel 1 News.
And now elsewhere, Cabinet has given the green light for government to write off non-performing loans to government entities amounting to 2.9 billion shillings.
In a special cabinet meeting chaired by President Uhuru Kenyatta, Cabinet gave a lifeline to public entities drowning in debt by okaying the policy paper on the proposed write-off and restructuring of principal and waiver of accrued interest relating to non-performing loans.
Now, the paper also proposes the restructuring and rescheduling of principal loans amounting to 764.3 million and conversion of grants of principal loans totaling 268.2 million shillings.
Now, the government has formed a multi-agency team to clean the Kenyan market of illicit goods starting from next month.
Now, the team, to be headed by Deputy Head of Public Service Wanyama Musiambu, will target counterfeits infiltrating the Kenyan market, blamed for killing local industries.
This comes even as Kenya Revenue Authority officials took the war on counterfeits to Limuru in Kiambu, impounding illicit gas.
The team, which comprises, among others, the Kenya Revenue Authority, the Kenya Bureau of Standards, the Anti-Counterfeit Agency and the police, will begin a mop-up exercise to get rid of substandard goods flooding the Kenyan market.
We are targeting falsification of imported goods. We are targeting cross-border smuggling of goods. We are targeting importation of counterfeit goods. We are targeting dumped goods. People can come and dump here. We are targeting substandard manufactured goods, either they are brought in substandard or they are made here locally, substandard, and you will find most of those, they don't have KBC stickers.
According to Deputy Head of Public Service Wanyama Musiambu, 55 foreigners were nabbed in Nairobi and deported to their respective countries while hawking goods in the city, yet they came to the country using a tourist visa. Musiambo also revealed that the anti-counterfeit team has discovered 9 unlicensed go-downs along Mombasa Road following a major operation. A thorough scrutiny of goods will now be carried out in all border points and random checkpoints erected in all major highways to ensure all illicit goods do not access the Kenyan market.
We have a multi-agency team. We have KRA there, we have anti-counterfeit there, we have KBC there, we have immigration there, we have customs there, and we have the police there. So that at every entry point, we have these teams. And so if things come in and we find they are substandard, then we will ask the relevant agency that is at that point, because every agency is represented at our entry and exit points.
Already 400 metric tons of sugar valued at 28 million shillings and 162 containers of illegal rice worth 100 million shillings have been destroyed. This came even as officials drawn from the Kenya Revenue Authority raided an illicit gas refilling facility in Limuru, Kiambu County.
This facility you see here has been packaging illegal gas, risking the lives of Kenyans around this area, and even doing a big blow to the bona fide manufacturers. We have found them to not to have to be licensed by the Energy Regulatory Commission. They have no KEB certification. They are not licensed.
The officials vowed to continue with similar crackdowns to eliminate the illegal trade.
And now the Meteorological Department is warning of warm and dry weather in the next 1 month.
The warning came just days after the country witnessed unprecedented floods that left trails of death and destruction across the country. I think at this point it's time for us to take a breather, but of course we'll be bringing you that story in a few. But of course, remember that interview by Catherine Achenga focusing on cancer. And obviously when you talk about the same, some of the lessons perhaps even for NHIF to look at is the treatment of cancer. Amanda goes in Cuba and, they're treating cancer free. And organ transplant.
We have a very long way to go, but at least we have a start with NHIF.
So perhaps treat a common cold free, can we?
Maybe we must first start by declaring a primary health
Absolutely,
care.
absolutely.
Then we can move from there. But that is a discussion I'll be having on your health segment, the burden of cancer, financing and treatment. Our guests in studio this evening, we have with us Julia Sooko, the Principal Healthcare Contracting at NHIF, as well as Dr. Alfred Karagdu, the Director for the National Cancer Institute. But before we take a break, a quick reminder of our opinion poll question, Joe.
Of course, from a big question, we're asking you what action should be taken against banks used to channel stolen NYS funds. What action should be taken against banks used to channel stolen NYS funds? Talk to us on 22162. That is our SMS line. Tell us who you are and where you're watching us from. Give us a short comment. We'll sample them at the tail end of this broadcast. On Twitter at KBC Channel 1, at J Curia, and at Kato Achenga.
Every 4 minutes is a chance for you to win big with Mega Dollar. Just go to Lipa na M-Pesa, enter paybill number 295888, account name KBC, and amount from 10 shillings or more. Then select your 10 numbers from 1 to 80 and send to 29588. You can win up to 30 million shillings. Start playing now and win. Mega Dollar. Big winners every 4 minutes.
De algún juego que quieres ganar sin tener piedad. ¿Quién eres tú?
We choose to go to explore the magical beauty around you, where no one thought we would go. We have gone for coursework, only to find more adventure, discovering something unfamiliar.
Which is quacking. When you step, it's like a bouncing castle.
At times, we look back just how we got here and where we might be going. And when we think our journey has reached an end, you will be surprised it is just the beginning. Magical Scenes with Irene Muchuma Odim, Thursdays only on KBC Channel 1.
All right, let's focus on a story that will lead us to an interview segment that will be done by Catherine Ochenge. And despite the entry of a National Health Insurance Fund, NHIF, in 2016 to finance diagnosis and treatment of cancer and other communicable diseases, the number of Kenyans seeking treatment abroad is still high.
Now, the number of cancer centers and oncologists in the country has relatively increased, yet many Kenyans are still forced to seek treatment in India, mainly because they believe the costs are lower for cancer treatment.
In addition, they are confident there will be an array of qualified specialists to attend to them, coupled with an aggressive marketing strategy by Indian hospitals in the country.
But are these costs lower at home or abroad? Dennis Mashigadi highlights the burden of cancer in tonight's special report.
With an estimated 45,000 new cancer cases reported annually, the burden of cancer is rising at an alarming rate, with reports by Economic Survey 2016 indicating that Kenyans are spending 8 billion shillings every year in search of cancer treatment in India, South Africa and Dubai. The number, which is estimated to rise in 2018, showed that 7,000 patients seek treatment abroad, with 5,600 being cancer patients.
Out of the 10,000 patients who travel abroad to seek treatment, 73% of the cases are cancer cases. And many of the treatments that they seek in India, one is what is known as a PET scan.
Meet Salima Kasaya, a high school teacher from Vihiga County battling breast cancer. Like many in her condition, the journey leading to her cancer diagnosis was a torturous one that meant hopping from several clinics before her final diagnosis.
So he told me to go in for a CT scan, which I did for the chest. And he told me now I have to compile everything, go with a good file, to give the next doctor an easy time so that he doesn't now start doing the tests and all that.
Many cancer patients in the country are forced to either commence the treatment at the two public facilities, Moi Teaching and Referral Hospital in Eldoret, or at the Kenyatta National Hospital in Nairobi.
And I know what this type of cancer means. He told me you cannot get treatment in Kisumu. There are now two places, either Eldoret or Nairobi.
Those who can afford treatment elsewhere often settle for private hospital or travel outside the country to India or South Africa, which have become favorite destinations.
Cancer, you have to have a multidisciplinary team. It's impossible to treat cancer by yourself. A lot of the times myself, I will consult other oncologists, I will consult other surgeons, I will consult pathology. So there are many people involved in giving the patient the correct treatment.
Oncologist Dr. Andrew Odhiambo, who also doubles up as an assistant lecturer at University of Nairobi and consultant at the Kenya National Hospital, says Kenya does not have cancer centers, which are one-stop shops where all medical diagnosis can be undertaken.
India has many comprehensive cancer centers, so you'd find all the services in one building rather than in most instances in Kenya where patients would have to move from one hospital to the next. India is also cheap because of economies of scale. You know, they have many numbers, so they are able to push down the cost because of volume.
Under the NHIF package, patients in need of chemotherapy get a cover of 25,000 shillings per session, while those getting radiotherapy treatment have a cover of 18,000 shillings per session. In addition, Kenyans needing computer topography or CT scans can have a cover of 8,000 shillings from NHIF, while those in need of magnetic resonance imaging or MRA can get 15,000 shillings. Linus Mwashigadi for your health.
Very well, it's time for your health segment, and our focus, of course, of discussion is today the cost of treatment of cancer. Remember that, of course, cancer is ranked as the third leading killer disease in Kenya, and of course there have been calls for the government to declare cancer a national disaster. And one of the issues that Kenyans continue to grapple with, even as the government talks about affordable healthcare, is whether indeed it is possible to reduce the cost of cancer, and what are some of the ways which we can be able to address this. Of course, that is what is forming the basis of our segment tonight, the burden of cancer, financing and treatment. What are some of the options that we have when we talk about cancer? And to help us digest and understand more as regards this particular topic today, we are joined with Julia Ouko, who is the Principal Healthcare Contracting at the National Hospital Insurance Fund, as well as Dr. Alfred Karagu, who is the Director for the National Cancer Institute. And of course, the National Cancer Institute is the coordinating body for all cancer control activities in Kenya. Thank you both for coming to our studios this evening. All right, and I want to start with you, Dr. As the coordinating body of cancer control activities in this country, what is the burden of disease, the burden of cancer in our country as we speak?
Thank you for having me. Cancer is a significant burden in this country, contributing to, as you rightly said, accounting for about 7% of our total mortality. We see about close to 39,000 new cases per year, and we also see about 28,000 deaths. So that is a concern, because that means that more than half of our cases end up succumbing to the illness. It's really something that we need to do something about as a country, and I think as an institute we are working very closely with various stakeholders as a coordinating body, so that we pool our resources and together to make sure that we have a united front towards addressing this burden. Yes.
Of course, there's been a push for us to declare cancer a national disaster. Do you think we are at that point?
I would say probably yes, because I think from what we have seen in the experience of other ailments, when something has been declared a national disaster, the advantage of that is that it's able to attract resources. Yes. I mean, it's sort of like a unifying factor for people to come together and forge a common front. And that is important, because when you look at cancer, is not a simple ailment like your malarias, your TB, and so forth, because it's a whole continuum. There's a whole journey. There's an element of screening and diagnosis, an element of treatment, the element of palliation. So all those elements require quite a bit of resources. So for me, I think it's a good conversation to have in terms of us trying to figure out how do we bring together stakeholders to how do we put resources. So I think that probably is a good way to approach the burden that we have as a country. Okay. Yes.
Julia, of course, one of the things that the government is trying to do is to make sure there is access to, medical care. And particularly I want to talk about medical insurance under NHIF. What is the uptake as we speak, before we focus on what you offer when it comes to cancer treatment? Are people responsive towards registering for NHIF?
Okay, currently as we stand, we are looking at 7 million principal members. So if you do a rough calculation times 3, because we're looking at a family, a spouse and a child, we are facing about 20 to 21 million Kenyan covered.
And so that's like about half of the
population. We are going there. And because of the access to healthcare and the Agenda 4, and the fact that we are supposed to bring in everybody so that we can access affordable healthcare as announced, our registration division is out there ensuring that everyone is registered, pools are coming in, and most of the Kenyans get covered. So I would say the uptake of NHIF cover or insurance, public insurance per se, is good, and it's something that is ongoing. And
in terms of patients who have cancer, what access do they have in terms of what are you able to treat them for?
Okay, you see, cancer, when you approach cancer, cancer has basically 3 protocols of treatment, and you're either going to undergo surgery, surgical treatment, you're either going to go through chemotherapy intervention or radiotherapy. So NHIF is financing all. If your cancer requires a surgical intervention, we come in with our surgical package comprehensively. If it requires chemotherapy, whether it is first line treatment or second line, even that we cover. If it requires radiotherapy, so we are in cancer management as a whole. Yes.
But how much is it that you can cover a person? Because we've seen incidences where people, yes, you have medical insurance, but you're told, you know what, your insurance is exhausted, you still need more money, because cancer is not cheap to treat.
Correct.
So when we talk about money, what are the estimates for the different levels?
Okay, so for surgical cases, they go through pre-authorizations. So once the hospital knows how much it's going to cost, they place the request and we approve. So it's based on a myriad of things when it comes to surgery. You can never tell how much they're going to bill you for surgical. But when it comes to chemotherapy, we have board approved rates. When it comes to radiotherapy, we have board approved rates. So we are looking at sustainable financing. We are looking at when, for example, we are managing cancer through first line treatment, we cover up to 6 sessions, 25,000 per session. When we enter into the second line, we cover up to 4 sessions of 150,000. If it has to be radiotherapy, we do 20 sessions of radio at 3,600. So when you look at it comprehensively, it's over 800,000 that we pay for a patient who's been diagnosed with cancer.
But of course, is that, Dr. is sufficient to treat cancer?
Well, I would say it's a good step. It's a good step, but probably not, I think from what you have seen, it's not able to cover all the elements that are required. For me, I think when you look at this in the context of the larger, universal healthcare, agenda,
yes,
it's a good step that we have started as a country in terms of having insurance, being able to cover cancer treatment, because I think not very many countries in the many developing countries are able to do that. So I think the first thing is a good step, because what we know is that cancer, just like many other non-communicable diseases, has the capability of impoverishing, our societies, our members of the community.
Yes.
So I think it's a good start that NHIF has done. So using that, then we can, and since we have lessons learned from there, and we have started seeing what some of the gaps that are there, because she has talked about there's a cap. Sometimes they're only able to provide up to a certain number of cycles.
Yes.
So now that we have that experience, it's much easier now for us even to start advocate when we engage with treasury, when we get with other players, to start and advocate to them about the need now to bridge the gaps that we have already observed from what has been able to be done for the past few years. But I think it's a good step.
But the perception that treating of cancer is easier, the cost of treatment is easier in India as opposed to Kenya, is it factual? Do you think that is the case, or it's more of a perception?
I think it's a mix of both. I think probably where the advantage that India has is that I think they're able to leverage on their well-established capacity, and they're able to leverage on, because they have a fairly well-established capacity, they're able to accommodate volumes. So like the way I think our capacity is fairly limited, so we aren't able to be able to have the efficiencies of having many numbers. So to some extent, I would say probably that's why some of the services, like for example, something like a PET scan. PET scans is not available in Kenya, so it's easier for it to be available. I mean, it's cheaper for it to be in India. But for some other services, I think the rates are actually comparable. And sometimes our argument is that there are other because for services that are equally available between India and Kenya, for example, there are other added advantages of having your treatment in Kenya, because there's family support, society, you don't have to travel. So that's why I would say it's a mix of both. For the services that are equally available here and India, I would say it's probably a perception, but for services that are not available here in Kenya, then it's actually true that those services are cheaper in India as compared to here.
All right. Yes. As NHIF, how efficient are you in terms of, when someone needs you to pay up your bills? Because there's always the perception that NHIF is slow, and then they want to lock you to certain hospitals to be able to access treatment.
Zeroing in on cancer, not many hospitals in the country provide cancer management. Currently, we are looking at close to 30 hospitals that are contracted to offer full cancer treatment.
Are they spread out across the country?
They are spread out in the major towns. And that's where you will find our oncologists. So that also brings us down to the human resource aspect. We do not have enough oncologists for the diagnoses we are seeing. Current data from Ministry of Health says that we get about 40,000 new diagnoses every year. But what is the increase in response to the human resource capacity to handle that? The healthcare facilities to handle the same. So the ones that are able to provide cancer management, those ones are contracted for the benefit of our members who have to access them for treatment. We are really not slow. We are quick, we are efficient, we are real time, and we get, the moment we are notified, we are able to approve, and the member continues on the treatment, because it's a whole system of approvals, it's a whole system of forms, it's a whole system of verification and confirmation, but it is efficient enough for cancer treatment and management.
All right, in terms of our priorities, as you know, the National Cancer Center, Institute rather, what areas are you prioritizing when it comes to cancer financing? What areas would you prioritize?
Well, I think we first of all, I would want to say that as the National Cancer Institute working with other organs in government, last year we actually launched our National Cancer Control Strategy. So what we did is that we identified 5 key areas, 5 key pillars that would help us in terms of addressing the cancer burden. So the first pillar is on issues around screening, early detection, because we realize that the bulk of our cases, will be in advanced stages. So the other area that we are focused on is actually now diagnosis, actual diagnosis. And the third element is the issues of treatment. And around treatment, I think one of the biggest concerns we have is the cost of treatment. So one of the ways that we are trying to when we're working very closely with the KEMSA, because we realize that one of the reasons why particularly the cost of medication has been so high is because as a country we have not been procuring cancer medicines in bulk. As we speak right now, we have early this year we actually developed a priority list of our essential medicines, like what would say the top 50 or 60 molecules that we want to as a country to use as our priority medicines, and KEMSA is currently in the process of procuring that.
So are we likely to see the costs coming down?
Yes, I can tell you that. For sure we will see costs coming down. And also aligned to that is that we have also been in very close engagements with the private sector. I know we are adopting a PPP arrangement to because I think the argument we are making to the private sector is that when we procure in bulk, so that we are able to supply our 2 referral hospitals, and we actually looking to have about 10 other county referral hospitals being able to provide chemotherapy drugs. So when you're able to procure for all those facilities, then you can assure them higher volumes, so they don't have to have as high markups as they are currently having. So those are the kinds of that's how we are prioritizing the area around treatment. Another key area that we are prioritizing also is research, because we appreciate that we don't have well-documented research in Kenya. So currently what we are doing is that we actually doing a systematic review of the research that has been done over the years, so that we have a baseline. Where are we? So that even as we move forward, even as we start identifying the areas that we want to start investing in terms of research, it's informed by what has been. So you're
still trying to find out which areas you need to prioritize when it comes to research cancer
Yeah, I think, it's what we have, what we have done is that we have done the systematic review. Actually, we have actually gone into our electronic databases. We are targeting repositories in our universities, because we realize that master students and our doctoral students are doing researches around cancer. That's actually ongoing. We have actually been able to highlight about, I think there are about 190 or so papers around cancer in Kenya. So we are trying to, so that's probably in the I would say with a timeline of around August, we shall be able to have a very clear understanding of this is what has been done in terms of research in Kenya. These are the gaps. So when we are trying to now to see where to put the money, then we'll have a very clear justification of what is required.
Okay, we are almost running out of time, but I want to come back to you, Julia. In terms of limitations and restrictions, what should patients know about the NHIF cover?
The NHIF cover, as it is comprehensive. So when you're diagnosed with cancer, come out. If you're a member, come out. If you're not a member, look into ways and become a member. Get registered, be a member. Then you'll be able to access the full range cover that we have brought in through surgical intervention, chemotherapy, and radiotherapy. So for Kenyans, we would encourage them to enroll to be members of NHIF and come out and access the packages that are there specific for cancer treatment. But even as we encourage them to come out, government would help us in bringing out the promotive preventive aspects, early diagnosis, screenings, and that would make even the management and the cost of care to reasonable levels. Because we are keen on sustainable financing, prudent management of resources in cancer management. We also want policies and regulations when it comes to medication. The cost of medication is ballooning, nobody is controlling it. Our human resource is also not up to the numbers that we are seeing. So it's a whole play in the health system. Our pillar is just to finance, but we need the entire health system to be worked up so that it's ready for the increase in numbers that we are seeing in cancer. Research is also key. We need to know why is cancer rising up. And also government putting in on the financing, stepping in onto the financing, so that it's not only members who are financing their treatment. In terms of remittances, are members remitting on time, or that is an issue for you as NHI? For those who are on employment, they are okay, but for the voluntary ones, the remittances come in. We would not say they're late or they're early, but they're there. Yes. They are not. It's not a challenge that you're living with. It is a challenge, because you find there are those adverse selections, there are those adverse effects, and somebody would remember, oh, I have NHIF, let me go pay because this diagnosis has now come up. So there are those hazards, moral hazards that every other insurance faces. Yes. All right. As we wind up, in terms of embracing technology as NCI, perhaps what is it that you're doing when it comes to creating awareness as regards cancer and treatment?
I mean, in terms of creating awareness, what we have specifically done is we have developed materials. Last year we launched some educational materials that empower our communities with issues around cancer, like what are the common signs and symptoms, how can you prevent yourself from cancer. So there's material that can be distributed to the general public. We have also developed a module because we are leveraging on some of the systems within the health sector. Within the health sector we have a cadre of people we call community health volunteers. These are people within the community. They live with, they are able to interact with the community. So there's a module that we have developed to train them, so that as they interacting with the community, they're able to give them more information on cancer. And finally, I think about technology. One of the areas that we want to, one of the ways that we want to really embrace technology and use technology to help us is in terms of doing our cancer registration, because we realize that even some of the figures that we are working with are more of estimates, and so we are trying than the actual figures. So we are using technology to be able to register and be able for our facilities all around the country, so that they're able to report more on a real time, more on a accurate, more complete data. Those are some of the areas that we are trying to use technology on. And finally, also some of the materials we are working with like we have had discussions with AMREF to see how some of our training material can be incorporated into e-learning material, because that is much easier than the traditional face-to-face kind of capacity building. So those are some of the areas that we're exploring.
Okay, Josephine, your last words as we wind up the show in terms of the uptake of NHIF and perhaps what you'd want to tell the public as regards treatment of cancer under your cover.
Okay, under our cover as NHIF cancer package, we have learnt lessons ever since we rolled it out 3 years back, and we are enhancing it as we discover the changes in regime, because each regime and each protocol is different. So that needs to be taken into consideration. We encourage Kenyans to come out. We encourage our government to help us to do preventive, promotive, to do screenings. We encourage Kenyans to be taught on how to take care of their bodies, nutritional aspects. But when you are diagnosed, it is stressful enough. Come out there with your good attitude, get your treatment, access the care that is there. Yes, because even attitude affects the outcome of your treatment. Okay. So we are there as NHIF for cancer treatment and management. We are open to changes, we are open to new regimes, we are open to financing it comprehensively for the sake of the Kenyans.
All right, thank you both. Julia Ouko, Principal Healthcare Contracting at the National Hospital Insurance Fund, as well as Dr. Alfred Karagu, the Director for the National Cancer Institute. Just put it into perspective, what are some of the things that they're doing as the different government bodies to ensure that at least there is access to cancer treatment, given that one of the big 4 agendas by government is affordable healthcare. And these are just some of the things that they're doing towards the issues of cancer treatment. This is where we put a cap on your health, but business news is up next, so stay tuned.
My partners will take you to the house so that you can see where the people who betrayed you are. But I really have to warn you about one thing. Vengeance is a dish that is better served cold, all right?
You traitor!
Y254, in conjunction with the Laikipia County government, bring to you the Laikipia Innovation Fair. Monday, 28th to Thursday, 31st May, live from Nyahururu Stadium. Log on to www.ajiradigital.go.ke and register to showcase your artistic talent during the auditions on Tuesday, 29th May. Come enjoy electrifying performances during the Innovation Fair by Eko Dida, Dufla, Tony Njenga alias Ngonyore, Irungu High Tech, Rose Sifuna, and many more local artists. Later on Thursday, 31st May at 3 p.m., the Y254 team takes the party to Laikipia University, Laikipia campus. Let's welcome Madaraka Day in style. Laikipia Innovation Fair, Monday 28th May to Thursday 31st May, live from Nyahururu Stadium.
Time for us to look into the money markets as well as what has been happening in business. Farmers who still have maize should source for another alternative market for the produce, since the government has no plans of reopening the National Cereals and Produce Board anytime soon to purchase maize. Agriculture and Irrigation Chief Administrative Secretary Andrew Timur says NCPB silos are full and the government is in the process of ascertaining the genuine farmers before making any payments for delivered maize. Timur says the farmer listing process will inform future engagements between the government and farmers.
Farmers who are turned away from delivering their maize to the National Cereals and Produce Board have in recent days intensified pleas that the government reopens the seal to purchase the produce. However, the government says this is unlikely after the exercise was marred by claims that traders had infiltrated the supply chain, prompting the government to order an audit of farmers to establish a new list of genuine farmers. Agriculture and Irrigation Chief Administrative Secretary Andrew Timur says NCPB silos are full, therefore farmers should source an alternative market for their produce.
For the first time, we bought more maize than we have ever done. Usually we buy about less than 2 million bags, but this time we hit about 3.6, almost 3.7 million bags. And most of our stores actually are full. But we know that there are farmers out there who still have maize, and if finances allowing, and if the government will still look into that. But for now, really, we're also asking those farmers if they can get alternative market for now. That would be at least for them not to keep the maize for too long.
He advised farmers to properly store their produce and avail it when National Cereals and Produce Board are reopened for the current crop harvests.
I am sure if the maize is well kept, if it is in stores and they are not in a hurry to sell, they will still be able to get market as we go along. We've been going through a vetting process to actually see who are the genuine farmers who actually bought maize from maybe elsewhere outside the country and sold to cereals board. Then if all the genuine farmers will be paid.
Hackers were challenged to leverage on the high internet and mobile penetration to develop apps that will link farmers to the market and disseminate crucial farming information.
The farmer has access to all this information, then he's able to decide with facts what is the planting period, what is the crop to be planted, and what are the timelines, how long do I wait, and even go to the extent of even identifying where is my marketplace.
And now enhancing digital literacy among the youth living in informal settlements is key in expanding the pool of employment opportunities as well as nurturing entrepreneurial skills. For this reason, Craft Silicon Foundation is expanding its digital literacy program powered by the solar-powered mobile computer bus to reach the less fortunate in Kenya and Uganda as part of its expansion strategy as a financial technology solutions provider. The program has so far equipped 9,400 trainees in Kenya with the necessary ICT skills on a free month training.
The computers we are launching today will provide crucial last-mile access to ICT resources to socially and economically marginalized communities in Kampala, Uganda. Kenya and Africa at large is currently grappling with the challenge of modernization. The use of information communication technology has been identified as a tool for modernization. However, the wide digital gap is the greatest hindrance to achievement to this vision.
I could see them articulating themselves, trying to explain how this is changing their lives. I could see the creativity beginning to bud in them. And I hope that in the program you're sharing, you're going to integrate some values so that they will also learn how to be trustworthy and so that they can have the full range of 21st century skills that will help them in the future, even as you equip them with digital skills.
Now, experts are calling for increased budgetary allocation to the agriculture sector in the coming financial year to effectively drive the country's food security agenda. The experts have raised concern of a small impact previous allocations have had in achieving the set targets in the sector.
The National Treasury is expected to table the 2018-2019 budget in Parliament next month, with the budget expected to hit 2.5 trillion shillings. The budget for the 2018-2019 financial year largely prioritizes financing the projects under the Big Four plan. According to the draft budget policy statement by the National Treasury, the agriculture, rural and urban development sector has been allocated 38.9 billion shillings, which National Treasury says will ensure the prioritized programs are fully implemented. Experts are however calling for increased budgetary allocation to the sector to more than 10% of the budget allocation.
Key finding, overall expenditure on food and nutritional security amounts to just about 3% of the budget, which is from a 1.8 trillion budget. That is not enough to give the impact you need on a very important human right.
We've got only 3% of the national budget allocated to agriculture, but there are three very clear other numbers that can be used to justify the impact or the little impact that 3% is having. The first is when you can quantify imports. imports last year versus exports. The second is when you look at per capita, so per person productivity.
According to them, the impact of the budgetary allocation to the sector over the years has been minimal. They are also calling for more incentives to farmers and institutional support to diversify food supply.
If you want to go large scale, you cannot continue using the small subsistence mechanisms of production. You have to go commercial.
If a farmer can go and buy food from the market and he has between 1 to 2 hectares of land that they can produce on, then it shows either they are doing things wrong or the enabling environment is not there.
Experts called for policy change that will effectively support the country's food security agenda.